currently. Can you hear me? Yeah. Hi, everybody. My name is Mary Jane Burke. I'm the county superintendent, lucky me, in Marin County. And I want to welcome you here. Happy New Year. I'm hoping that people had a good chance to get a break. I know not everybody did, but for those of you that did, wonderful. Welcome back to the new year, as we'll say. I just want to say a couple of comments. I know there's a lot going on in our country right now, and I do have a request for all of us that if there was ever a time that we have a moral imperative to absolutely ensure equity of opportunity and equity of respect, now is that time. And so if we can all do our part by doing anything we can to help bridge the various opinions that we know exist in our schools, in our county, and obviously in our country, so we can move forward effectively on behalf of all. I want to make a few comments and begin by expressing my thanks to the education community in Marin County for everything you have done to lead the state of California, and in fact, you're leading the national communication as well. The reopening plans that we're beginning to see both in California and at the state level are directly related to the work that's been done here in Marin County. I think you're aware that our new president has said that his first 100 days, he will be focusing on reopening schools for in-person opportunity. You may know that Linda Darling-Hammond, the secretary, the president of the state board, is serving as the leader for the transition team for President Biden. And she is well aware of the work that you've been involved in Marin County, and very recently when the governor shared the information about his reopening plans for the schools in California. During that press conference, Marin County's data and work was referenced by the governor, the state superintendent, and by Linda Darling-Hammond. And so what we can know is that as things begin to evolve and we get more information, that in fact will be very familiar to you, particularly as you see the protocols that are being identified. They're exactly the protocols taken from Marin, the school site specific plan, precisely taken from the work that you've been doing here in Marin County. So to all of you, thank you for what you've done to lead the way, and we are all aware that in fact without each and every one of you in our school community being willing to step into in-person instruction, we wouldn't be where we are today. For you all to know, at this point, a majority of our schools are open. I think it's 95 of our schools are currently open. We still have a few high schools, middle schools that are not yet in place, but we're prepared to open. But given the tier that we're in currently, are not now able to open until they move to the red tier. A couple of things I just want to note. Just got a word in the last couple of minutes that tomorrow at 11 o'clock, the governor will be unveiling the budget. And so while I know for some of us or some of you, you'll be working with students during that time, I just want you to know that that will begin to be available. Members of my team will be briefed on that budget later at 3 o'clock. So we'll get more details out as we understand it. And on the 21st of this month, at 5 o'clock, we will have both Brooks Allen, who's the governor's #1 advisor, and Mike Fine, the head of ThickMap, will be doing an overview for the Marin community specifically. So we'll make sure that everyone has the information related to that as well. So we mixed it up a little bit. We had a call on Monday with the larger community. Some of you may have had the chance to participate. There were over 900 people on that call, and subsequent to the call, we've had over 3,000 people view that actual session. And there were many, many questions that came up that we were not able to get to. So we decided to flip it. And so today's session is going to start with the questions that we heard then that we didn't get to, specifically those that had been framed likely from school staff, maybe not, but so we're going to start with the questions so that you'll have a context as Dr. Santora goes through the slide deck about the data. So that's our plan. We hope to have some time for questions as well at the end. So please, if you have any, put those in the chat. We do have a hard stop at 5 o'clock. And with that, Dr. Santora, first of all, thank you very much for everything you've been doing to be available. Just yesterday, Dr. Santora was available to a group of students who had similar questions to others about, what the data was saying. So thank you for making yourself available to us. We really appreciate it. We appreciate your great team and can't wait to hear more about vaccinations and, everything we know about, where we're headed. So thank you.
Thank you, Mary Jane. We've definitely going to be very question focused, but I do have some data slides. It's the nerd in me, the proud nerd in me, just to make sure that as we're referencing some of the data as we're referencing the questions, that people have the picture of the data in their head. So we absolutely want to be questions oriented and solutions focused with you today. And I'm excited to be here. Happy New Year for those of you that weren't on the previous call. And just to echo Mary Jane's sentiments, we are so thankful for the educators and school staff and childcare workers and learning hubs, this greater network that really has been focused on children first and making sure our children have access to learning first, and now working together to move towards in-person learning, which we know is what children need. So just highlighting some things before the questions, lots of questions, so don't worry. We have a new surveillance system, a new database system. This is a little bit late, but when you go on our website, you'll see the most up-to-date information. And what's notable to me as a physician and epidemiologist, you'll see after schools closed, and far after there could have been any potential school infections, school-based transmissions, we saw the highest infection rates in our community. And that's really, again, driven by people gathering. I sound like a broken record, I know, but by people gathering with multiple households, especially over the holidays when families chose to both travel and as well as meet with other households. And we still are in tier purple, as Mary Jane mentioned, and we are going to be seeing our stay-at-home order extended. We are improving our ICU capacity in the Bay Area, but we have still not reached that 15% threshold in the Bay Area. In Marin County, we are now over 10% ICU availability, so we're faring much better. Again, Marin County is one of the healthiest counties in the state, and so that protects us from all diseases and poor outcomes and hospitalizations. So we are still in tier purple. And Dr. Willis shared this, even though our case rate is high in Marin County, we are faring so much better than the other counties. And again, I think this is driven by the commitment of the majority. I really do believe that the majority of Marin County residents are following best practices and are following public health orders and are staying at home and in place and using all the personal protective recommendations that we have in place to protect not only themselves and their families in the community, but we are still seeing cases increase, especially during the holiday gatherings. And so we, as was mentioned previously, even though we are at a stay-at-home order, we have identified that schools are part of our critical infrastructure and they can be open. There still are some older guidance and regulations that we thought would be changed, most notably the secondary schools. In the summer, they issued a waiver program that allowed TK through 6th grade to open with the waiver in the purple tier or tier 1. That waiver, we were anticipating an update in that waiver that would allow schools both at the primary school level as well as the middle and high school or secondary school levels to open when we're in tier 1. That has not yet been changed. So that's why some of our secondary schools that have not yet opened still are not open yet because they cannot apply for a waiver at this time, pending changes and guidance from the state. And so this is going to be the first round of questions, is all about our dashboard. We have from the beginning been committed to sharing our data and being transparent and sharing information that's related to our schools and schools activities. When we first opened, there was always a concern that schools could be a driver of community transmission. We're not seeing that in Marin County. And we now have 6 suspected in-school transmissions, and all of them have been at the primary school level. And 2 have been amongst staff to staff, 2 of students to students, and 2 from staff to students. And so there's been, again, no student to staff, documented student or suspected student to staff transmission in the school environment. And now we're going to jump to the questions. So who is entering the dashboard data? So, and how do we know this is accurate? So there's 2 sources of information for the dashboard. We work really closely with the Marin County Office of Education to have the most updated information around attendance. And so the school days is calculated based on the number of students who are attending a specific number of days in school. So we have some schools that have, for example, they have their full school population attending school 5 days a week. And so they would get their school population multiplied by the number of school days, so 5. And then we also have schools that are in a hybrid mode where they have children that are attending school 2 days a week and or 3 days a week. And so we do the multiplier based on the number of students and the number of actual days that they're estimated to attend based on the current opening status of that school. So that's what composes our student days. And then we have the other side, which is the public health side of that data. And that is information that we get. We have all of the amazing public health liaisons who are on this call today or on this, or may not be, but I'm so thankful to all that you are doing, who communicate with our team, our public health team, our schools team, when there are known positive cases of students and or staff on the school campus. We also receive notification through our own system. All COVID positive cases in Marin County need to be, public health needs to be notified. And when we identify children who might be of school age level, our team completes a contact investigation to identify if they're in school, if they're attending a hybrid school or a school in person, or if they're attending remotely. And then when our team interviews new cases that may be school staff, one of the first questions we ask is where they're employed. So we can track down occupational exposures of COVID-19. So it's 2 ways we're receiving information, both from the schools themselves. Oftentimes it is the school that finds out there's a positive person first, because we have electronic health records, and many of you will get a notice in your email that you have tested positive, and that information goes to you. And hopefully you're following our family handbook guidance and notifying your school, or if you're staff, you're notifying the school right away if you have a positive test. And even if that fails, we have our safety is that all laboratories are required to report positive tests into our public health system, and then we investigate it. So the confirmed positive students and staff only include those that attend school on site. So there are many children and students that have not yet returned at all to the school campus. And so those students are not included in that dashboard. And then the other factor that so who's entering data, and this is really important. One of the first questions when we get notified of a potential exposure event, that's what we call them, exposure events at the school, we interview the school staff to identify if the child or staff were on campus during their infectious period. There's a defined period where people are considered infectious. It is either 2 days before they're symptomatic or 2 days prior to a positive test. And we then look at a time frame, determine were they on campus and was there a potential exposure event based on their attendance. And so not all students, just based on holidays and vacations and other reasons, not all students are on campus during their infectious period. And that's really our goal with the family handbook, is that if anyone in a household is being evaluated for COVID-19 because they're symptomatic, students should stay at home in order to prevent a potential exposure event, especially since we know household transmission, usually 20% of a household will test positive for COVID-19. So that's why we encourage any student who has a family member who is symptomatic for COVID-19 and then is getting tested for COVID-19, they should stay at home until whether they have symptoms or not, until they know the results of that test. And so then each week, our epidemiologists, we have a team of amazing epidemiologists, and our nurses get together to review all of the exposure events. We had a flurry of activity right before the end of the school year, and where we had over 90, by the end of the school year, we investigated over 90 school events, school exposure events. And we then, based on the interviews and determining whether it was school-based, potential for school-based exposures. What happens with, especially at the elementary school level, once there is identified of an exposure event, then we recommend the cohort closure. Again, this is a very conservative measure. The majority of individuals who are in a classroom would not be considered close contacts, but we are at this point having a very conservative approach towards at the elementary school level for classroom closure, and considering everyone in that classroom a close contact, even though that's not truly the case. We then recommend that those students in the potentially exposed classroom get tested 5 days after the last known exposure to a positive case. This is a place where we, again, if there's any positives that are resultant, and that's how we have found the suspected school-based transmissions, is students that have tested positive after, or staff who've tested positive after an exposure event, that's what's then counted towards our school-based transmission. So it's both evaluating the data that we have, working with both our case investigation, contact tracing division to make sure we have a safety net for identifying potential students or staff that are not notified, that do not notify the school of a positive COVID status. And then our nurses working with the schools team to just discuss and learn about the exposure event itself. So if there are any positives, to determine if it was a school-based or community-based transmission. And then the last question is can you provide more information how school-based transmissions might be further reduced? And so I really, again, I think the first key is for individuals to follow the handbook. And I think the number one is if someone's in a household is being evaluated for COVID-19, the student should stay at home, whether they have symptoms or not. If there's been and number two, if anyone's engaged in a high-risk activity, so they've traveled, they've met with other households, they should self-quarantine. So even though they don't have a known exposure, if what we're seeing right now and why the cases are going up is because family members from different households have gathered over the holidays. And once you bring 2 to 3 households together, indoors, not wearing masks, and especially eating together and drinking together, that's when we're seeing COVID-19 transmission. So people really following the stay-at-home guidance and limiting their interactions with other households while there's higher prevalence of COVID-19. Especially we're seeing some of the cases is that families are visiting counties with higher prevalence than Marin County. So some of the new positives that we've seen is that families have gone down to Los Angeles County or have had family members from Los Angeles County. And you can see the difference in the case rate between our county and other counties across the state. So again, really trying to follow our guidance will help. And then where we see, and this is consistent, it's not just in schools, it's across all occupations, including healthcare workers, is when we're seeing occupational transmission, it's usually because there's a breach in personal protective behaviors. And the number one thing is eating together. We often see, so when colleagues and staff are breaking together and eating together, that's when you're not sitting 6 feet apart, your masks are off, and you're conversating. So again, that's why we really want structured environments when any eating is going on the school campus. If students are inside eating, keeping the windows open, and then after eating, putting their masks right back on their faces. And again, what we really have seen is more adult to adult transmission in those scenarios, not student to student transmission. So I think right now, starting a new year, just reviewing our family handbook, doubling down on our efforts, hand washing. I think people are not washing their hands as much as they should be because they're wearing their face covers and they're maintaining distance. The thing that protects us the most from all viral illnesses is washing our hands. And that is where we need to go back and getting the chafed hands that we had in February and March, is washing our hands all the time. So before I jump there onto vaccination and the questions around vaccination, Mary Jane, anything else you want to address on the dashboard? All right. we'll just keep.
Sorry. I just had myself on mute. I apologize. There's a couple of questions that have come up that I would just like to see if we can get to. There's a question here asking about whether we're getting input about from teachers, staff about what's working, what's not working. And if I take the county office as an example, the answer is absolutely yes. We are constantly asking our staff what's happening, and is there anything else we need to know? What do we need to upgrade, etc. And so I believe that kind of dialogue will be happening at the district level. So that's one. We received a reminder from one of our staff that, and this is really on me, that I very often am using the word children or, you know, as if it's a child. And I know that some of you are teaching high school and I should be using the term students. And so I will work on that. And I apologize because that is an absolute issue that I should deal with differently. So I'll try to do that. There's a question about high schools that are currently open for hybrid learning, not learning pods. How many of these are private high schools and how many are public? It's I think all of the schools that are currently open, high schools are private high schools. However, as an example, the Tam High School District was scheduled to have begun opening this week. And the only reason that they're unable to is because of the current purple tier. So I know that our public high schools are in line and moving forward. Let me think if there's anything else that I can find. The handbook is there. I think we're good. Lisa. Let's go ahead and move on.
Vaccine. This is the most busy part of my day right now, and it's the probably the highest number of emails I'm receiving is all around vaccination and everyone wanting to know when they're on queue. Vaccination for the school community is a little bit different than our approach, and we're really we're heartened again to see the governor also lead with recognizing that workers in education and childcare would be prioritized. Dr. Willis led earlier than the state in stating that we know vaccination would be one of the tools to reassure school staff, even though we're demonstrating very low levels of school-based transmission, only 6 unknown or suspected cases of school-based transmission. We know that vaccine is the next tool to help us out of this pandemic. And so we've already been working with the Office of Education to begin planning for vaccinating all staff who are on campus and having contact with children and students, children and adolescents or students. So that will be coming soon. We're hoping we'll move to phase 1B by February. We have very limited vaccine supply. We received great news that we're strengthening. We have a wonderful partnership with Kaiser and Marin Health, and that is strengthening so we can bring our vaccines together so we can clear through phase 1A, which is healthcare workers, and hopefully be on schedule by beginning of February for moving into phase 1B. But as you can see here, there's very different risks. And it's a different approach where the 75 plus population is included in this group because they're at greatest risk for morbidity and mortality associated with COVID-19. And the reason why education and childcare providers, it's not the highest risk group based on data that we're seeing when there is occupational exposure. The 2 groups that are highest in Marin County is in construction and food service workers. Those are the 2 highest groups. But there's such a priority for the return of students to school, which is why this lower risk group is being included in phase 1B tier 1. It's not because of the risk, it's because of it's a policy decision to support the full reopening of in-person instruction in the state of California. So these are the vaccination questions that came up. I think I already mentioned it. It's gonna hopefully start in February. Most likely it will start at our pod, our point of distribution center. And we're calling them closed pods or closed vaccine clinics because you're required to have an invitation to this vaccine based on your status as a school employee or a childcare worker. That being said, we are looking at opportunities to scale that up, potentially having, just like we have testing across the county, looking to have county vaccine clinics across the county. And we're also working with other for-profit corporate entities to bring more vaccines. So for example, Safeway, CVS, and Walgreens. Those are active partnerships that we have at the county level to administer vaccines. And then lastly is that we have what we call multi-county entities. Those are Sutter and Kaiser in Marin County, where they're also receiving vaccine and moving through the tiers. So there may be a point when vaccine is sufficient at, for example, at the Kaiser level, that teachers or school staff would also be able to get vaccinated through their health plan. So that's all happening. It's very complicated. It's a lot of moving pieces. But again, our goal is by the beginning of February to begin 1B vaccination. Right now, there is conversation about the 1-dose strategy, just in order to move through these phases more quickly and get people vaccinated. There has not been a decision at the state level, regional level, or county level. We are still moving forward with the 2-dose vaccination strategy. There's a strong evidence. They have moved forward in the United Kingdom with the 1-dose strategy. So there's other countries that are doing this, especially with the Pfizer vaccine, which after 1 dose has a more than 90% effectiveness. So there's scientific grounds for going with the 1 dose, but we at this point, there's no plan to change that. Vaccinations will not be required. We do not see any mandatory order for vaccination at this time, and there's not even conversations around that. We meet with all the Association of Bay Area Health Officers, and that was a very strong, rapid no when this topic in a policy discussion came up months ago. So it will not be required. The way that you're going to be signing up is there'll be an advisory that goes out through the schools, through our communication with the schools, that you'll be provided with a link to register for a particular clinic. So we have the links are directly connected to the days that we're offering the clinics, and you'll register it, and then you'll receive notice to go to that clinic. And then most importantly, you'll receive, by registering, you'll also be notified when it's time for that 2nd dose. The 2nd dose is required 21 days after the Pfizer first dose, and 28 days after the Moderna first dose. We're right now having a conversation with the superintendents and the Office of Education around prioritization. This is scarce resource allocation. These are very hard conversations. There'll be a grand rounds next week around the ethical considerations of vaccination. And there's lots of ethical considerations around vaccination. And some of it would be, is the prioritization. So the state has given us some parameters. So for example, based on age, there's certain staff that may be at greater vulnerability for poor outcomes from COVID-19. So age would be consideration. Also, for example, we would prioritize people that are working, for example, in special education, where there's been some of the behavioral challenges and they're in the classroom, behavioral challenges as it relates to consistent personal protective behaviors. And so those are conversations, but we haven't set a policy yet. And childcare providers are absolutely included. We are so thankful. Since the beginning, childcare providers and learning hubs were the first to go online. And so they are a priority group. The challenge is everyone, and based on my inbox, everyone's a priority. And so that's where we'll be moving forward with some of these hard policy conversations when there is limited vaccine supply on how to make sure it gets out equitably and with parity across all of the school districts, private, independent, parochial, and hopefully there's just more vaccine supply that's coming. So that's the vaccine questions. Anything else?
Yeah, Lisa, there's a couple things that have shown up in the chat. One, yes, this includes public, private, independent, and parochial schools. When we're talking about childcare providers, this would be in a group setting or home childcare, along with people who have been working directly with kids in learning hubs. So you can imagine there's a broader group there. There's an equity lens being used at the county level, particularly when it will come to the actual sign up. So for example, people with privilege might have an easier access, right, to the vaccine, yet we might have some people in the community that don't have access to the internet, English is not their first language, and so there will be opportunities for people, by way of example, to sign an affidavit in order to confirm that they're working working for the system. If you live outside of the Marin County, but you work in Marin County, the answer is yes, you'll be able to get your vaccination here. A question was in the chat about why isn't there a requirement yet, or will vaccinations be required for school staff? At this point, public health is not requiring it. We're going to be using the, come on everybody, let's do this. Obviously, it will be tracked to try to get a sense of what the numbers actually are. But I do want to note that employers are able to mandate the vaccination as a term of employment, if you will. And I've read that now in multiple different places. That is not the plan. Our hope is that 95% of our school staff will want to have the opportunity to be vaccinated.
Great.
Okay.
There's something and I forgot.
Yeah, Lisa, let me just look and see if there's anything else. Kenny, do you see anything else in the chat about anything else in the chat?
There are a couple.
Vaccination related.
One is with vaccinations in short supply, how will schools be chosen as the vaccine rollout begins?
So I think you know what we're talking about. I do believe that we are definitely going to be going to people with direct interaction with students first. And I just want to clarify, so there's a question here about, for example, a custodian that's working at a school. Absolutely. Right. School secretary, absolutely. So we're not talking about teacher versus, we're talking about everybody who's in play. But for example, someone like me that's at a district, at an office that does not have routine interaction with students, that I would be very much at the end of the list versus at the, you know, or maybe not even on the first prioritization. But yes, it'll be everyone. But also I just think that, you know, the hope, right, is that we will not be reading what's happening in the rest of the country. What are you hearing is that they have the vaccines, but they're not able to figure out how to deploy them. That is not the case in Marin County. Your school leaders are absolutely raising their hand, saying we will do anything. Some of you are aware potentially that Kaiser Permanente, by way of example, has already a routine structure where they have been willing to come to our school sites to give flu shots, by way of example. So, you know, what we're going to have to figure out is who's got it, you know, who's got the vaccination, and how are we going to be good partners in order to make it happen. But we should be, there's like a lot of competition, as Dr. Santora said, about trying to get the vaccine. So we should be very happy that we're in the front. And just for you to know, starting next week, our school healthcare staff, the nurses, the LVNs, are actually scheduled to be in 1A. So they will be getting their vaccinations. Lisa, am I right, next week?
Yes, even as early as potentially this week.
Okay, good. So hold the thought, some hope there. And, you know, I'm setting a target, and, you know, I first said February 23rd, all school people have their vaccination, number one, and number two, based on listening and Lisa's clarification, I'm saying, you know, by March, we'll all be done. That's the target that we're looking for. And hopefully it'll be sooner than that.
There's an additional question, actually a few that are related to this topic. Where would teachers who are currently doing distance learning fall in the vaccine? Would this be a chance for teachers with underlying conditions to be able to go back into the classroom?
Absolutely. And this is where, again, having those conversations about just who's first in line in the teacher group, again, vaccinating those that are already on site, but we're not going to jump over. If you're a distance teacher or distance staff, you won't be jumped over. You will be in that group. And it's just, again, it's just based on allocations. And this week we're just doing kind of first come, first serve. It becomes an equity issue though. We're seeing it already as, again, where affluent, educated, white residents are advocating and accessing the technology they need to enroll in clinics. And we in public health recognize we need to do more in order to make sure we remove any barriers to accessing this vaccine, from improving our outreach and education around the vaccine itself. There's a lot of concerns. And again, we know this, we have a lot of diversity both across the school community and educational attainment levels of staff, English proficiency, period. And so again, we need to do more to make sure that we have equity in this distribution, and looking at drop-in, for example, drop-in vaccine clinics for our designated staff who might have challenges with the technology of signing up. So our challenge in Marin County, and we saw this with H1N1 in 2009, is our white communities will rapidly take up this vaccine, and we need to make sure there's equity across Marin County, and that low-income communities, communities of color, immigrant communities understand the benefits of vaccine and get vaccinated. That's going to be our challenge together. So we're up to that challenge, but we have limited resources, and that's something that we remain committed to.
Lisa, once I get a vaccine, does that mean that I can no longer, quote, get the virus or shed the virus?
We are seeing, it's not uncommon, and I'm sure you see the same news I see. If someone gets vaccinated, it's because of the prevalence of COVID-19 now. Within days, after getting vaccinated, you could still have already been infected with COVID-19. We do think, though, that within a couple of weeks, you have protection against COVID-19. That being said, we are still going to be wearing masks if you are vaccinated, you've completed your vaccine cycle, you're still required to follow the same protective measures of physical distancing, wearing a mask. That is not a reason to stop wearing a mask. We need time. This is a new vaccine, and we need time to demonstrate its effectiveness. It is one of the most effective vaccines I've ever seen in my career, based on the data that we saw. Many of you have seen my nerd slides of basically within 8 days, the group of individuals vaccinated compared to the control group of the unvaccinated group, it drops off, the level of COVID-19 drops off after 8 to 10 days of vaccination. So it's very, very promising, but you'll still have to wear a face cover. And the only thing that popped up to me is that it won't be required for school, but this is very relevant in the Marin community, not to be surprised if travel requires vaccination. And so that might be the driver for some other people to get vaccinated, is it might be required vaccine passports. It might be required for travel.
Okay, Lisa, yeah, let's go ahead and move on real quick.
Yeah, so this is just, you've all seen this, and I think just the point out here is that we have data around secondary schools. I know this is a big concern. The state released only information around TK through 6. Most of the research that is published is around TK through 6, but we have had almost, probably at this point, we'll have over 200,000 student days at the secondary school level, students in middle school and in high school. And as I said previously, we have not had secondary school transmission in those suspected school transmissions. So it is something that we're tracking. We're leading, and when you're leading, you might not, I think what I hear in the community is people want to see hundreds of thousands of data points around the safety of school. We are leading in Marin with having this data and being transparent and sharing it with the state. The state is going to be implementing a new system called SPOT, which we're training right now. So and making sure our dashboard aligns with the state's dashboard when that goes live. And so we're working on that now. And again, we still are confident in that our school site specific protection plans are offering the safety that all students need at all grade levels to have in-person instruction.
Mm-hmm. Hey, Lisa, could you talk about the new variant?
I have a slide. I have questions.
Okay.
I got that.
I'm sorry, I just saw that question. Thank you.
Yeah. So, and we'll share these slides. I've shared this. I didn't want to spend too much of a point on any of these. It was already mentioned earlier on this, but the California Safe Schools Plan for All does have its website. There will be more resources when the budget is approved tomorrow, or when it goes live, for schools to improve their investments in personal protective equipment and other resources. And it's fully aligned with, it should not look very different from what you've seen in Marin County, because we really were a model for their work on this front. This is just their evidence summary. We have a bibliography that we've also been publishing, and it's very consistent with what the state scientists and clinicians are seeing around why it's safe for students to be back at school. And that is, again, children are less likely to transmit this disease, especially in the school environment. It's not common for us to see transmission among students in the school environment. We are looking at testing. Right now, we do recommending screening and testing of symptomatic students and staff. We're waiting for the governor and the school task force around new guidance around testing asymptomatic students and teachers and staff, school staff. So we're waiting to see what that looks like, and we're ready to employ enhanced testing at the school sites. And again, we never will have a zero risk option. Life is full of risks, but every layer that we have provides further reduces the risk of school-based transmission, and that's our commitment as we work together to reduce the risk of school transmission. But now we're back to questions, the core of this presentation. Go ahead. I can't see. We have been doing this now for 10 months. The case rate is higher. Why wait more months? We believe now that the harm of waiting for the return of students to in-person instruction outweighs the benefits of waiting. We are seeing the emotional, physical, and mental toll on students, and we have demonstrated that students can safely return to a safer classroom environment. We see that it's riskier for students to be at home. That's where we see higher rates of transmission than to be in school. In school, it's a controlled, supervised environment. And when we stabilize, when people are not on vacation and are not gathering and not meeting with other households, we anticipate to see reduction in cases in Marin County. And again, what we hope to see in Marin County, consistent with what we saw after the July wave, was that Marin County returned to orange faster than many other areas across the state. And then if you remember, we stayed orange and red longer than many other counties did when we saw the second wave of COVID-19 activity. So we believe that the harm that students are experiencing of being out of school outweighs the benefits of delaying the return to school. Again, what we see where children, adolescents are at home, there are some households that have a very supervised environment and can attest that their child has not left the house and are engaged in risk behaviors. There's many more households across Marin County that are dual working families with essential workers where there's not the same level of supervision. And again, school is safer for many of those students. And school offers so much. It's the fabric of our community. And that's why we have been moving forward with the safe return of students to schools. Do we have any examples of middle or high schools? And yes, we do. It's our private high schools and middle schools have returned. And again, we've been really proud of that leadership. Earlier on in the year, you saw what were the risk behaviors in that population, and were parties. And it's not students being at risk when they're on the school campus. It was students placing themselves at risk, or parents assenting to having gatherings at home, which violated both public health orders as it relates to gatherings, and also violated orders as it relates to social host ordinance where alcohol was involved. So those are the behaviors that are risky. It's not being in a supervised, structured environment. And so we're really, again, proud of the work of the private high schools and independent high schools that have opened and have done very conscientiously, very conservatively, and with strong communications and accountability within those high schools. Can middle high schools develop plans to have smaller cohorts? Yes, we provide guidance. The public health provides guidance, but each individual school and school district can determine how they interpret our guidance and apply that guidance to their own organization based on the culture of each individual school or district. Sports. We're going to be lagging in sports. We have seen from examples from collegiate sports to professional sports, the risk of competitive sports in the transmission of COVID-19 because especially with the higher, when there's contact sports and higher aerobic activity, those place increased risk for droplet transmission of COVID-19. So Marin County will not lead in the reopening of sports. We will follow the state guidance for the reopening of sports. So at this point, only outdoor activities are allowed. No gyms are allowed to be open at all. And it's only for strength and conditioning. all physical activities, including any sports that are training, students should be 6 feet apart. They should be wearing face coverings, whether indoors or outdoors, unless it's in an outdoor pool. And it should not be no competition, no scrimmaging, no full out practice. It should only be for strength and conditioning. And is the state considering waiver applications? We believe the state is considering ending the waiver process and moving forward, that schools at all levels will just need to have a school site specific protection plan and a Cal OSHA plan for occupational exposures, but that has not yet been published.
Yeah, Lisa, if I could add here, just to get to the middle or high school examples, there are several public middle schools that are open in Marin County that we could get guidance from. In the Larkspur District, Hall Middle School, Miller Creek, Mill Valley Middle School, Kent Middle School, and I'm sure there's others. So we could get some insight from those. Also Del Mar Middle School. So we do have several secondary quote middle schools that are operating in person, and they're public schools.
Anything else in the chat that we should address?
Can you help there?
There are a number of questions related to the new strain, and I know we're going to get to that.
We're coming up to the strain, the new strain. Oh, look, it's the next slide, the new strain. So it's a new mutation. So we have many strains. We had a study, you might have heard me on the call before, earlier this week. Marin County had one of the most diverse group of strains when we did a sequencing of a sample, a wide sample of COVID-19, of nasopharyngeal specimens. It was nasopharyngeal then when we were collecting them. And there's 6 known strains, and then there's mutations of each strain. We have in Marin County circulating Milan strain, Barcelona strain, Wuhan strain, a Switzerland strain, multiple strains. We also probably already have this UK strain. The UK strain was identified in September, which means it was circulating before September. There's always a lag, and we learned this well with COVID-19. There's always a lag of what you know from a scientific basis and what is happening in the natural world. So this strain has probably been circulating for a month or 2 before it was confirmed and identified in September. This is normal for viruses. They mutate, that's what they do. And sometimes they emerge and disappear, and sometimes they stick and become a dominant strain in any given community. We are still researching this strain. There is some concern that this strain can replicate more quickly and is more easily transmissible, but it's the same personal protective behaviors regardless of strain that's going to protect us, whether it's this UK variant or the Wuhan variant, that's going to protect us, and that is preventing respiratory droplets from going from one person to another. So it's under a lot of investigation right now. It's the CDC is investigating it, World Health Organization, National Health Services is investigating it to determine what we know about this strain, how it should affect our public health policies. So there's a lot to be seen. We're closely following it ourselves. What happened in the UK is what's happened here is that this particular strain emerged at the same time because of weather. People were moving indoors. Because of holidays, people were gathering more with multiple households indoors. And so it's not necessarily the fact that just the strain itself is causing what, if you looked at the epi curve that you saw for us, it's very similar to what the UK was. We have not yet identified this strain in Marin County. We do send specimens on a regular basis to the state laboratory, which does sequencing to assess the dynamics of different mutations and variants in the Bay Area and across the state. So I think it's what we saw the surge in the UK is probably more attributable to the weather and the behaviors of people gathering than necessarily the strain itself, but we'll be closely following that. And again, it goes back to a virus. We know how to protect ourselves from a virus. We wash our hands, we wear a face covering, we maximize distancing, and we don't gather together. So any more questions on the chat about the strain? And we'll share when we share the PowerPoint presentations, they have all the links to the different references that we're tracking so you can learn more.
And Lisa, you have updated the bibliography, and we just put that into the chat.
Great.
All right, so that's an updated bibliography that Dr. Santor has been providing to the community.
You all get to see my hobby is reading about COVID at 11 o'clock at night. So we try, and again, we're committed not only to the data that we have, but Dr. Willis and I, on a serious note, we do closely follow emerging evidence from across the globe. We don't just look at California, we look at Canada, UK, Italy, China with a grain of salt. But we are looking at international studies and trying to understand the most that we can understand about COVID-19 to implement policies that protect our community. That's our primary goal. The new strain, we're seeing right now improvements in our ICU availability. What we see consistently is that 5% of active cases, and right now we have the most active cases than we've ever had. We have over 700 active cases, but typically 5% of active cases are hospitalized in Marin County. Notably, what we saw right after, and I've mentioned it on previous events, is that we saw a shift from, there was a time where the Latinx community was disproportionately represented in COVID-19 transmission. And then after Halloween and going into Thanksgiving, we saw that shift to an older white population in Marin County. And now we've seen it shift back to spread among the Latinx community, shifted a bit northward where it was previously all about the Canal area. And now we're seeing more transmission in Novato and areas across Marin County. So we don't have the same geographic location. But when that happens, we also see the age range shift down. So where in November we saw it shift up to the 55 to 64 population, we now have seen it shift down to the 19 to 34 population, which is why we think there's lower hospitalizations, even though we have more active cases right now. What happens for staff and students who need critical care if ICUs are full? That is our responsibility. Our top responsibility, besides protecting lives, is protecting our healthcare system. And so the policies that we implement are designed to protect our healthcare system and decrease transmission, which will then decrease the risk of having more vulnerable populations hospitalized. And again, this is where we think, again, it's really critical. We know the greatest risk of those getting hospitalized are those over the age of 70, and especially those that are living in our residential care facilities for the elderly and skilled nursing facilities. So this is, again, where we have a lot of control, and especially within families in the school community, is if we are mixing, for example, there will be a time we'll go back to recommending that it's not just staying at home, but you can mix up to 3 households. You have to remember, anytime you're mixing with 3 households, you yourself are the most likely, adults are the most likely, not the children, but the adults are the most likely ones to then transmit it to older members of their family. So anytime we're mixing, you really need to be cognizant of who then, after you spend time with, who you spend time with next, because we know there's a significant amount of asymptomatic COVID-19. We know that adolescents and children and young adults clear this really fast. They have 1 or 2 days of symptoms, if that. And we know it's the greater than 70 population that has the highest risk for more severe disease and poor outcomes of that disease. So, which is, again, we have seen more cases now go up when regular business operations are not in place, and because people were gathering. And so again, that's our goal, is to get us back to the purple tier and the red tier, which is they're stabilizing as long as people are practicing their personal protective behaviors. I've talked a lot about the gatherings. That is the primary source of infection. We do still see occupational exposures. And again, the 3 biggest ones for us are those who work in facilities that provide care, because they're providing personal care, from washing and bathing, feeding, very close, intimate personal care. So increases risk of transmission. Construction work is high. There's a lot of shared equipment and varying personal protective behaviors in place on a construction site. And then food service workers. So not restaurant customers per se, but food service workers when they're working a line. And again, a lot of that's more led by collegial social behavior than even the work itself. It's what people do on break time is when they're often more lax in their own personal protective behaviors. It could, the strain could impact schools. Going back to the strain, we're closely following it. When we opened school September 8th, we were waiting to see were we going to see an increase in cases, because schools, even though we're creating very controlled, safer environments, they're still considered a congregation, right? You're having a community or a campus. We didn't see that in September. We also were closely following after our recommendation around supporting the return to school after Thanksgiving, when we knew people were gathering for the holidays, and we didn't see an increase in school-based transmission. And then now we'll be closely following this week. Dr. Willis and I are always ready. And I think this is something I hear people think we're set in our ways. We're not. We're always ready to change course if the data and science show that we need to. Our primary goal is saving lives and protecting lives, preventing COVID-19 activity and transmission across the school community and across the community at large, and then protecting our healthcare system. So those are our three primary goals. And if any data indicates that we need to shift course, update guidance, close schools, we're ready to do that, driven by data. With Governor Newsom making a priority, when do you see it? Some schools are already back to school 5 days a week. Some schools already have full in-person instruction 5 days a week. We believe with our guidance that we can do that. That would be something we also would closely follow. When more schools go back to 5 days a week, full in person, we'll be very much looking at our data to see if that we need to course correct or provide more education and training to support the return of full in-person instruction. But in Marin County, there are schools that have fully returned 5 days a week. The majority of those schools, though, are private schools. And that is our goal. That's what we've set as a 2021 goal. And I think putting goals out there is important. And I think we'd like to see students at all grade levels return for full-time in-person instruction. And it may not be achieved at all schools, at all grade levels, but I think together we can set that goal and have a shared goal. Anything else on this slide for you, Mary Jane?
No, I think I'm pretty sure we're right, almost up to 5 o'clock. I just want to make a couple of comments about, is this the next slide?
Yeah, this is a, I think.
Okay, then go. Yeah, let me have you go before I say something then.
Testing. I mentioned testing earlier. We are going to be following the state guidance when we get it around testing. We believe it's going to be, there's going to be testing recommended when a community is in a higher prevalence. They're calling it deep purple. An adjusted case rate of greater than 14 is when they would recommend enhanced testing, but we're waiting to see that. As I mentioned previously, we were one of the pilot sites. We always want to be at the head of the curve in Marin. And so we're ready to support testing and more testing at schools as recommended by the state. School staff can get tested. We just launched Curative Thursday. Yesterday, we have the Curative drive-through now. And so there's more testing available. We have mobile sites across the county. There's testing that's available. You have the best test, and I know I sound like a broken record to myself. The best COVID test is when it's on someone that has a known exposure to COVID-19 to get tested 5 days after that known exposure, or to get tested if they have symptoms consistent with COVID-19. These are every test is an emergency use authorization only test, and they're not research-based for mass screening. We're using these tests for that purpose because it is a pandemic, but there's always a risk of false positives and false negatives when you're not being tested only because of an exposure or because of symptoms. That's always a risk. If someone is symptomatic and negative, especially on the new Binax or antigen tests, we're recommending that they get the PCR or molecular test because the antigen tests are only positive for like this certain period of time for 2 to 3 days when you're at your most infectious. And your body, if your immune system is working, will start clearing out that virus and eliminate evidence. And it also goes to the other side where a lot of the tests, when we are getting tests that are positive, they're not infectious. So we have many individuals who test positive for COVID-19 way past their infectious period, and we're still excluding those students and staff from school, even though they're not posing a risk. And so that will be something that we refine as we get better tests and more information and data around school-based activity. The 5-day wait period is critical. After an exposure or after a high-risk activity, if you were to test the day following, you wouldn't have enough virus in your body to test positive. And so that's why we really strongly wait for people to get tested 5 days after an exposure event or 5 days after a high risk activity. If you test too soon, whether it's PCR or antigen test, it will be most likely negative. You need time for your body to become infected. You can, because many people can be exposed to COVID-19. If you have a healthy immune system, you can be exposed, you can wipe it on your face. And if you have a healthy immune system, you might not become infected because your immune system will work and you'll never test positive for COVID-19. I think I'm one of those people that was exposed, but I just never developed symptoms and never developed the symptoms, never got infected. And curative testing, we are confident in curative testing. They're receiving scrutiny because they represent more than 10%. That's Dr. Willis, I'll call him back. They represent more than 10% of tests nationwide. They have one of the most sensitive tests, greater than 90% sensitivity, which is really valuable for tests. All tests should be done with, again, we're using these tests as screening tools or surveillance tools when they're really designed as clinical tools for those that are exposed and symptomatic. But these are the best tools that we have, and we do think testing is critically important, which is why we've been bringing more testing to the community. Whew. Do you want to pause here? I know we're approaching the end.
I know we're close. Lisa, let me just, a couple of these questions. One, the schools are still in a situation where we do not want extra people on the campus. So if you will just hold that thought, that first question, can you bring in nonprofit groups, extra volunteers, etc.? The answer is no at this time. There are no updates to the busing or student transportation at this point. And so that is still in play. If parents who participate in non-essential travel, there is a place that people can be reported if they don't follow the rules. Lisa, what is that number?
No, you can't report individuals.
Oh, you can't?
No.
Come on.
I'm not calling everyone that traveled.
Okay.
No, but we know this is happening. We spoke to the Marine School Nurses Organization. I think these are the hard conversations, really encouraging families and students to be good citizens right now. And what a perfect time for that messaging, and for principals and to potentially have to have some of the harder conversations. We have heard where parents report one thing and then the student tells a teacher that they went to Tahoe. And so that's the reality. That is, we strongly are, it's against the rules. It's a stay-at-home order in place. And then two, it increases fear, worry, and anxiety when our school community doesn't feel they can trust the members of the community. So we really are strongly encouraging people to follow the rules and follow the orders, and then to self-quarantine if they did engage in non-essential travel. And that it is the schools, it's not an order in Marin County, just to distinguish. Santa Clara and San Francisco County has mandatory orders that mandate people must quarantine. Marin County, we opted not. We're hoping to have voluntary compliance, which we do know the majority of people are complying with us. We do know there's always exceptions to the rule. And then with school, parents' choices is first. Parents have choice. I know different school districts have different accommodations they have made. Parents may be happy or unhappy with the accommodations that have been made for virtual learning. But it is parents' choice of whether they send their students to school.
And so just to add to that, we have seen an increase, just for you to know, in the number of parents who have been sending their students to school from the beginning. Several districts have reported that we're up at about between 85 and 90%. If I could just, a couple of questions in the chat had to do with the cohorts. Are we changing the cohort sizes, et cetera? And just to clarify, from the very beginning, the 30-point plan allowed for a typical class size to be the size of the grouping of children that would be in a classroom. Dr. Santora has addressed multiple times the issue of a one larger stable cohort and the implications of two small cohorts with students mixing with other people, and what the implications of that can be from a public health standpoint. The other piece that I just want everyone to be aware of is that what we did in Marin County is we offered a path. June 18th, 30-point plan. Here's the opportunities. District had the choice to take advantage or not take advantage. As we know, the outcome has our districts and our communities have determined that they feel comfortable and safe to be able to offer opportunities to students for in-person learning. I want you to know that that's exactly what the governor is doing now. Nothing that he's framing has anything to do with a mandate. It's providing an opportunity for those that have not yet leaned in to offer in person to be able to do so and sort of set aside the roadblocks. And what we're going to see as we look at what the governor sets out is even more flexibility. So we'll see more opportunity and flexibility. But as you know, many people in the state have said they are not opening this year at all, and it isn't even good enough to have a vaccination. So just know that different communities approach these issues in different ways, and that we're in a situation where there'll be options, and we'll see different districts choose to determine what their next steps are. I want you to know that I'm very proud to be the county superintendent in Marin County, where such a high percentage of our schools are offering in-person opportunities for students. So I think with that, I'd be very interested if anyone, as we close this meeting, if you thought this was helpful, I would love you to put a note in the chat because we could offer another opportunity specifically for school staff in the next round. So if you considered it helpful, that would be great to hear from you. Lisa, anything else to close?
Just my deepest gratitude to all of you. It is us working together. We're learning every day and we're challenged every day to do better. That's our commitment in public health to the community, is to, again, achieve our goal of reducing COVID-19 transmission and to ending this pandemic, which it is in sight with vaccinations. Again, we have now seen the harm that children are across Marin County are experiencing because of being out of school. And we are encouraged to see with the new administration and more supports that we in Marin County can continue leading and to support all students return to in-person instruction. And we have tools to do that. So I just want to thank everyone. It's been a long road. I really do believe 2021 is going to be a brighter year, and together we can do this. So thank you so much for your time today.
Okay, great. Thank you, everybody. Appreciate it. Have a great evening. Bye-bye.